There have been a lot of days for paramedics with Smith's ambulance services lately. Challenging days because the Whitbourne emergency room is closed. Closed since June 27th. That was nearly 5 months ago. It's because there aren't enough doctors. Just 2 more are needed to reopen 24/7. Smith's ambulances haven't been parking here much lately.
It is frustrating, depressing.
Wade Smith owns the private ambulance service in the area. The doctor shortage is causing a chain reaction in the healthcare system, closing the Whitbourne ER and putting pressure on paramedics, forcing patients to be transported further, longer to hospital.
It means that the ambulance is gone out of the area. Red alerts, no coverage for 4 to 6 hours. Nearest ambulance probably 35, 40 minutes away.
On this day, an ambulance is off to St. John's on short notice to help answer emergencies in the city.
When the health science gets short resources, they call on private operators to come in and help fill the gaps for them. They go into what's called red alert when they don't have ambulances to respond to calls. So they take ambulances out of other areas that may have a spare one. In this particular case, they took one of ours.
For paramedic Rudy Mercer, it means he's out of the office and into an ambulance. Just another day with the unpredictability of paramedicine.
A week and a half ago, we had 4 ambulances gone. 2 gone on routines, 2 doing back-to-back emergencies, and we were 6 to 7 hours with not one ambulance in our particular area.
Another ambulance is on the road, this time 25 kilometers away, to Dildo. They're transporting a patient to a doctor's appointment in St. John's, an hour's drive, one way. Leaving Smith's outfit with just 1 ambulance if another emergency arises. There's a 4th one, but it isn't staffed full-time, despite Smith's pleas for more money to hire more paramedics. Since the Whitbourne ER closed, Smith's has answered more than 300 calls, one time even responding to the Whitbourne Health Centre.
The nurses are not allowed to triage or treat a patient out there. And in one case, we had to transport a chest pain who actually came in for a doctor's appointment.
Smith's covers a big area, 14 communities from Roach's Line to Chance Cove. A round trip to the hospital can take up to 4 hours. They take patients mostly to Carbonear, 45 minutes drive one way, and to St. John's, which is an hour, and Placentia, a 35-minute run. And when paramedics get to one of those hospitals, there are often lengthy delays waiting to offload patients.
I mean, we're standing in hallways, no place to sit down, attending to patients for anywhere from 2, 4, 6 hours, sitting in the back of an ambulance with a COVID-positive patient or possible COVID patient for hours on end.
A paramedic's job is tough, and it's grinding them down.
It's a never-ending battle with long transport times, fatigued crew, patients just complaining that it's taking forever to get an ambulance and taking forever to get to a hospital.
And in a rural area where everyone knows everyone, some calls hit too close to home.
I picked up my family members. My father passed away. I was on call. I had to respond. That was 16 years ago.
Every paramedic has a breaking point. Mercer hasn't reached his yet, but it's clear he's close.
I gotta be honest with you, after 30 years of doing this job, I actually said to my wife there for the first time in my life within the last 2 months, I'm ready to go. I'm like, can you give me a job somewhere else? Is there somewhere else I can go? I'm actually getting frustrated.
How does that make you feel?
Not good, not good. This is a long job. It is actually very hard. Not knowing if in a month's time, 6 months' time, if you're going to have a job because you can't handle it no more.
Veterans like Mercer are hard to replace. It takes 6 months or longer to hire someone new these days, says Smith.
For us to recruit staff is almost nearly impossible. We've had people that's leaving the industry because of the pandemic and because of the way the system's been operated by government over the last 7 years.
He says working short puts extra pressure on new, young staff, people like Erica Clark, who's been on the job for a week.
This is my first solo call without a third on with us.
That call was cancelled yesterday, but dispatch didn't tell them. Now she's back at base, waiting for the next one. It's rest time for some, and lunch for others.
Female? Okay.
Time to suit up and see what the next call will bring. Being on the road is costing more and more. Gas, insurance, supplies, repairs, all cost a lot more these days. And paramedics say it doesn't help that a $50,000 government recruitment bonus was only meant for people living away, not ones already here, like Mercer.
It was like a kick. It was an insult to every paramedic who works on the island. I don't care if you're hospital-based or private. That was a kick. It hurt.
5 months the Whitbourne ER has been closed. Smith's fears are growing, even though Eastern Health promises it's not going to close the ER permanently.
I think they need to come out and tell the public what is actually going to happen to Newhook, if it's going to be a 24-hour system or if it's going to be a Monday to Friday clinic. I'm worried about things to come.